You will wake up tomorrow morning. You will go to the kitchen. You reach for your favorite cup of coffee. But suddenly a doctor tells you, your stomach problems might be caused by coffee, your daily energy drink, your morning ritual, your productivity booster. Could it actually be harming your digestive system? Or could it actually help your gut instead? The truth is far more complicated than you think, because modern research shows something surprising. Coffee can heal your gut in some cases and damage it in others. What coffee really does inside your stomach. Why some people get acid reflux, diarrhea, or stomach pain after coffee. Why others experience better digestion and less constipation. Which diseases coffee can trigger in the gut. And how to drink coffee without harming your digestive system. By the end of this video, you will understand exactly how coffee interacts with your gastrointestinal system. And you might never drink coffee the same way again. But before we begin, if you enjoy simple medical documentaries that reveal the truth about health, subscribe and hit the notification bell, because the next videos might save your life or someone you love. Now, let's begin the journey inside your digestive system. What happens in your body when you drink coffee? Coffee is one of the most consumed beverages in the world. More than 2 billion cups are consumed every single day. For millions of people, coffee is not just a drink. It is a daily ritual. But most people don't realize something important. Coffee is not just caffeine. Coffee contains over 1,000 chemical compounds. Health. These include caffeine, chlorogenic acids, polyphenols, diterpenes, organic acids, antioxidants. These chemicals interact with almost every part of your digestive system. Your digestive system includes mouth, esophagus, stomach, small intestine, large intestine, colon. Coffee affects all of them. Within 4 minutes after drinking coffee, your colon becomes more active. That means coffee can stimulate gut movement, digestive hormones, acid production, bile secretion, which is why many people say, coffee makes me go to the bathroom. But this effect is only one small piece of the story. Because coffee can influence digestion in 3 main ways. 1. Coffee stimulates stomach acid. Coffee stimulates the release of the hormone gastrin, which increases stomach acid production. This acid helps break down food, but too much acid can cause heartburn, acid reflux, gastritis. Coffee stimulates gut movement. Coffee increases peristalsis, the wave-like movement that pushes food through the intestines. That's why coffee can help people with constipation, slow digestion. 3. Coffee stimulates digestive hormones. Coffee stimulates hormones such as gastrin, cholecystokinin, CCK. These hormones increase digestion, bile secretion, intestinal movement, coffee, and health. So coffee is not just a stimulant for the brain. It is also a powerful stimulant for the gut. But here is where things get complicated. Because while coffee may help digestion for some people, for others, it can trigger serious gastrointestinal symptoms. Why coffee affects people differently. Some people drink 5 cups of coffee every day and feel perfectly fine. Others drink half a cup and immediately experience stomach pain, acid reflux, diarrhea, bloating. Why does this happen? Scientists believe there are 4 major reasons. 1. Genetic sensitivity to caffeine. Some people metabolize caffeine slowly. This causes caffeine to stay longer in the body. As a result, they experience stomach irritation, anxiety, digestive discomfort. 2. Pre-existing digestive diseases. People with digestive disorders are more sensitive to coffee. These include GERD, gastritis, irritable bowel syndrome. In these patients, coffee may worsen symptoms. Drinking coffee on an empty stomach. Many people drink coffee first thing in the morning, but drinking coffee on an empty stomach can increase stomach acidity. This may lead to nausea, stomach pain, heartburn, diarrhea. 4. Amount of coffee consumed. Moderate coffee intake is usually considered safe. Experts generally recommend less than 400 mg caffeine per day. That equals roughly 3 4 cups of coffee. Very well help. Drinking more than this increases risk of digestive problems, reflux, diarrhea, coffee and acid reflux. One of the most common digestive conditions associated with coffee is GERD, gastroesophageal reflux disease. GERD occurs when stomach acid flows back into the esophagus. This causes symptoms like heartburn, chest burning, sour taste in mouth, difficulty swallowing. Coffee can worsen GERD in several ways. 1. Coffee increases stomach acid. Coffee stimulates gastrin, which increases gastric acid secretion. More acid means a higher chance of reflux. 2. Coffee may relax the esophageal sphincter. The lower esophageal sphincter is a valve between the stomach and esophagus. If it relaxes too much, stomach acid can flow upward. Some research suggests caffeine may weaken this valve. 3. Coffee worsens reflux during fasting. Research shows reflux is more likely when coffee is consumed on an empty stomach in people with GERD. Symptoms of coffee-triggered GERD. These symptoms usually appear 30-60 minutes after coffee. Burning chest pain, acidic taste in mouth, burping, nausea, upper abdominal discomfort. Investigations for GERD. Doctors may order 1. Upper endoscopy. A camera is inserted into the esophagus. This checks for esophageal inflammation, ulcers. Barrett's esophagus. 2. 24-hour pH monitoring. Measures acid exposure in the esophagus. 3. Manometry. Tests esophageal muscle function. Treatment of GERD. Treatment includes lifestyle changes. Reduce coffee intake. Avoid coffee on empty stomach. Avoid lying down after drinking coffee. Medications. Proton pump inhibitors, H2 blockers, antacids. Coffee and irritable bowel syndrome. Boo. Another digestive disorder linked with coffee is IBS. IBS is a functional bowel disorder causing abdominal pain, diarrhea, constipation, bloating. Coffee can stimulate colon movement and increase bowel activity. For some IBS patients, this can trigger symptoms. Healthline. But interestingly, some studies show coffee may actually reduce IBS risk in certain populations. This is why scientists say coffee and IBS have a complex relationship. Symptoms triggered by coffee and IBS: abdominal cramps, diarrhea, bloating, urgency to pass stool, investigation of IBS. Diagnosis usually involves ruling out other diseases. Doctors may order stool tests, colonoscopy, blood tests, treatment, lifestyle changes, low FODMAP diet, reducing caffeine, stress management, medications, antispasmodics, fiber supplement, probiotics. Coffee and constipation. Here is the surprising part. Coffee may actually help relieve constipation. Coffee stimulates colon contractions. Research shows coffee can increase colon activity more than water. This stimulates bowel movement. That is why many people say, coffee helps me poop. In fact, for some people coffee works almost like a natural laxative. Why coffee stimulates bowel movements? Coffee triggers gastrin release, colon motility, gastrocolic reflex. All of these stimulate bowel movement. When coffee causes diarrhea, however, too much coffee can cause diarrhea, abdominal cramps, especially in people with IBS. But coffee's story inside your digestive system doesn't end here. In fact, things become even more interesting when we look at how coffee affects stomach diseases like gastritis and ulcers. Coffee and stomach diseases. Coffee and gastritis. Now let's talk about one of the most common stomach problems linked to coffee: gastritis. Gastritis means inflammation of the stomach lining. This lining normally protects your stomach from strong digestive acids, but when it becomes irritated, symptoms may appear. The most common causes include infection with Helicobacter pylori, long-term painkiller use, alcohol, smoking, excess coffee consumption. Research shows that frequent coffee consumption can stimulate stomach acid production and irritate the stomach lining, which may contribute to gastritis in some people. People with gastritis may experience burning stomach pain, nausea, vomiting, bloating, loss of appetite, indigestion, Sometimes gastritis causes no symptoms at all. Investigations. Doctors may order 1. Upper endoscopy. A camera is inserted through the mouth to look inside the stomach. It can detect inflammation, ulcers, bleeding. 2. H. pylori testing. This may include breath test, stool antigen test, biopsy during endoscopy. Treatment. Common treatments include proton pump inhibitors, pantoprazole, antacids, antibiotics if H. pylori infection is present, and importantly, reducing foods that irritate the stomach such as alcohol, spicy foods, excess coffee, and peptic ulcers. A peptic ulcer is an open sore in the stomach or duodenum. For many years, doctors believed coffee directly caused ulcers, but modern research shows the main causes are H. pylori infection, long-term NSAID use. Interestingly, many studies show coffee is not directly associated with peptic ulcers, coffee and health. However, coffee can still worsen symptoms by increasing stomach acid. Symptoms of peptic ulcers: burning stomach pain, pain between meals, nighttime pain, nausea, vomiting, black stool. Investigations. Doctors may perform endoscopy, H. pylori testing, blood tests. Treatment. Treatment includes proton pump inhibitors, antibiotics for H. pylori, stopping NSAIDs, dietary modifications. Some patients are advised to limit coffee temporarily while the ulcer heals. Coffee and gut bacteria. Now we enter one of the most fascinating discoveries in modern medicine. Your gut contains trillions of bacteria. This is called the gut microbiome. And coffee may actually influence these microbes. Recent research shows moderate coffee consumption can increase beneficial gut bacteria such as bifidobacterium and increase microbial diversity. A diverse microbiome is associated with stronger immunity, better digestion, reduced inflammation. Coffee contains compounds that act like prebiotics, feeding beneficial bacteria. But there is a limit. Very high coffee consumption, more than 5 cups daily, may worsen reflux disorders and inflammatory bowel diseases in some individuals. So again, the relationship between coffee and gut health is complex. Investigations. A&D medical management. When coffee causes digestive symptoms. If someone frequently experiences symptoms after drinking coffee, doctors may investigate. These symptoms include persistent heartburn, chronic diarrhea, severe stomach pain, unexplained weight loss, vomiting blood, black stools. These symptoms may signal serious gastrointestinal disease. Common medical tests. 1. Upper GI endoscopy, used to detect gastritis, ulcers, esophagitis, tumors. Colonoscopy. Examines the colon and detects inflammatory bowel disease, polyps, colorectal cancer. 3. Stool tests. These help identify infections, inflammatory markers, bleeding. 4. Breath tests, used to detect Helicobacter pylori infection. Medical treatments. Depending on the diagnosis, doctors may prescribe acid-reducing medications, proton pump inhibitors, H2 blockers, motility medications, antispasmodics, prokinetic drugs, probiotics. Used to restore healthy gut bacteria. How to drink coffee without harming your gut. Now comes the question everyone asks. Should you stop drinking coffee? For most healthy people, the answer is no. Moderate coffee consumption is generally safe and may even support digestion by stimulating digestive hormones and bowel motility. Coffee and health. But the key word is moderation. Safe coffee habits for gut health. 1. Limit coffee intake. Experts usually recommend 3-4 cups per day maximum. 2. Avoid coffee on an empty stomach. Always try to drink coffee after food. 3. Avoid coffee before sleep. Late coffee may worsen acid reflux. 4. Choose low-acid coffee. Dark roast coffee often contains less acidity. 5. Listen to your body. If coffee causes symptoms such as reflux, diarrhea, stomach pain, reducing intake may help. Coffee is one of the most fascinating drinks in human history. It can stimulate digestion, support gut bacteria, relieve constipation. But it can also trigger problems like reflux, gastritis, IBS symptoms. The difference often depends on how much coffee you drink, your individual digestive system. So the real question is not, is coffee good or bad? The real question is coffee good for you? If you learned something new today, share this video with someone who drinks coffee every morning. Because millions of people suffer digestive problems without knowing the real cause. And if you enjoy medical documentaries explained in simple language, subscribe and turn on notifications. Because the next video might reveal the hidden dangers of everyday foods.